In the grand arena of healthcare discourse, a podcast conversation featuring the irrepressible comedian Bobby Lee unfolded as a symphony of impassioned advocacy for the concept of Medicare for all, juxtaposed against the staunch advocacy for individual responsibility in healthcare financing by the guest.
Free healthcare for everyone.
Okay.
I believe that, whatever it is that you earn, excuse me, you should be able to pay for your own healthcare. I don't want to pay for your healthcare. I don't think that my income, that I worked hard, that I should be supplementing anyone else's healthcare or anything else for them.
Okay. Well, I'm going to say this. Can I say this? Is that some people were not born in the situations that we've been born in, and I would like to. You can have some of my money because I want to help you, because I've been blessed, and I have a career that's amazing, and I've had my parents took me to museums and shit. I mean, I was a fucking kid, but I had a really good upbringing, and I was born into an upper middle class home, and I'm grateful for that. But it's like, I believe that some people are not born in those kind of situations. They're born to a single mother. Maybe they're born into extreme poverty, and they don't have the opportunities that I had. And it's like, all right, you can't afford medicine. You can take some of my money, and we'll get you medicine. I believe that every citizen in this country should get free health care.
No, and I agree
that we lost billions of dollars into the Iraq war. Where did that money go?
Right. No, and I agree with you, but that's your upbringing. For me, we didn't have everything either. My parents came here as refugees with nothing but the clothes on their back, but they were able to pick themselves up on their own.
That's true.
We weren't on welfare. We didn't get government assistance.
But did you have both parents?
I did have both parents.
Okay, you're lucky then.
But my dad was the only one working.
That's fine. You're lucky though, because some people are born into their mother being a crack addict. The father's not around, and then the mother has 3 kids, and these kids are fucked. What are you going to do about them?
This intellectual tug-of-war, marked by fervent exchanges, underscores the profound complexities that shroud the topic of healthcare reform. Bobby Lee's fervent defense of Medicare for all resounded with a clarion call for universal access to healthcare, irrespective of one's financial standing. He spoke with an unwavering conviction that resonated deeply, proclaiming that the right to healthcare should be an indomitable pillar of any just society. In Bobby's eyes, it is a moral imperative to extend the protective cloak of healthcare to every citizen, regardless of their economic circumstances. The guest, however, championed a contrasting viewpoint, asserting that individuals should shoulder the financial responsibility of their own healthcare. Their argument rested on the bedrock of self-reliance and personal accountability, a stance deeply rooted in their parents' refugee background. This perspective, anchored in a belief in individualism and self-sufficiency, represents a polar opposite to Bobby's impassioned advocacy for collective responsibility in healthcare provision. Bobby's spirited defense of Medicare for all was deeply intertwined with a sense of empathy for those who lack the privileges he has enjoyed throughout his life. He acknowledged his own fortuitous upbringing, one marked by supportive parents and opportunities galore. However, he recognized that not all are blessed with such advantages. In a poignant acknowledgement of the disparities that define the human experience, Bobby underscored that some individuals are born into circumstances of abject poverty or adversity, facing Herculean odds from the very beginning. Bobby's impassioned plea for Medicare for all was not just a matter of policy, it was a heartfelt cry for justice. He questioned how society should respond to those born into situations of extreme disadvantage, where the absence of resources and opportunities casts a long shadow over their lives. In his view, the only just and humane response is to extend the mantle of healthcare as a fundamental right, offering a lifeline to those who find themselves ensnared by the unforgiving tendrils of hardship. The clash of perspectives between Bobby and the guest offered a window into the complex tapestry of the American healthcare debate. It was a clash not just of ideas, but of values, one that encapsulated the fundamental questions that haunt healthcare reform discussions, questions of individualism versus collectivism, self-reliance versus social responsibility, and privilege versus disadvantage. Bobby's impassioned defense of Medicare for all, buttressed by his poignant recounting of individuals born into adversity, underscored the moral urgency he attached to the issue. He queried what could be done to uplift those whose lives are marred by challenges like having a crack-addicted mother and an absent father. For Bobby, Medicare for All emerged as a beacon of hope, a policy that could serve as a ladder for those trapped in the abyss of disadvantage. The guest's perspective, which emphasizes individual responsibility and self-reliance in healthcare financing, aligns with certain aspects of the current healthcare system in the United States. It reflects the principles of a market-driven healthcare system, where individuals are expected to take charge of their healthcare costs and make decisions based on their personal financial capacity and preferences. In the United States, the predominant healthcare model is one where individuals often rely on a combination of private health insurance coverage, employer-sponsored plans, and out-of-pocket payments to access medical services. This system places a significant burden of responsibility on individuals to manage their healthcare expenses, choose insurance plans that align with their needs, and navigate the complexities of medical billing and cost-sharing. The guest's perspective resonates with the ethos of personal choice and autonomy that underpins the current U.S. healthcare landscape. Individuals are encouraged to select healthcare plans that suit their circumstances, ranging from high-deductible plans with low premiums to comprehensive coverage with higher premiums. This variety of options allows people to make choices that align with their risk tolerance and financial means. Furthermore, the emphasis on self-reliance and personal accountability in the guest's perspective reflects a broader societal value of individualism that has deep roots in American culture. It aligns with the idea that individuals should have the freedom to make choices about their healthcare based on their personal preferences and circumstances. However, it's important to acknowledge that while the guest's perspective aligns with certain aspects of the current healthcare system, it also raises critical questions and concerns. The U.S. healthcare system is known for its complexities, including issues related to the affordability of care, insurance coverage gaps, and the challenges of navigating a fragmented system. As a result, not everyone has equal access to healthcare services, and disparities in health outcomes persist. The guest's perspective, while advocating for individual responsibility, may not fully address the systemic issues and inequalities that exist within the current healthcare system. It may overlook the fact that factors such as income, employment status, and pre-existing conditions can significantly impact an individual's ability to secure adequate healthcare coverage and afford necessary medical treatments. In the crucible of this podcast conversation, the arguments and counterarguments swirled with a sense of gravity and profundity. Bobby Lee's unwavering advocacy for Medicare for all, grounded in a profound sense of empathy and justice, clashed with the guest's resolute stance on individual responsibility and self-reliance. In the final analysis, this exchange of ideas serves as a microcosm of the broader healthcare debate in the United States, a debate characterized by a coalition of values, perspectives, and beliefs. While the resolution of these debates remains elusive, one thing is certain: the conversation will persist, for the issues at stake are nothing less than matters of life and death, justice and equity, and the soul of a nation.